but thank goodness that the body is, as resilient as it is, because that would suggest crowded teeth and narrow jaws, which would set you up for cranial problems and problems for the nervous system. I mean, it's an accident waiting to happen, isn't it?
It is, and it's almost like a nice reminder of just how adaptable the body is. And so when someone comes in, I mean, I'm sure you've seen patients, I certainly have, where like you look at the mouth and you're like, geez, this isn't textbook. Like, I'd love to do this, and I'd love to do this, and I'd love to do this, and if we could move this here, etc., etc., it'd be a beautiful mouth. But you step back and you talk with that patient, and like they're in like great health. Like
Yeah.
they're emotionally really solid. They've got a really balanced nervous system. Their nutrition's great. They're not in any pain. They've got a massive smile on their face. Their oral hygiene is great. What's there to change?
Yeah.
And it's just a beautiful representation of just how powerful the body's ability is to adapt. And so, if we're going to make change in the body, at least from a structural standpoint, we have to use forces that are biomimetic, that are mimicking the forces that biology itself uses, rather than mechanical, because mechanical is going to lead to failure, whereas biomimetic is going to lead to something a lot more gentler, which the body can work with because it's a physiological force. And that's kind of the big premise behind the types of appliances that I use.
Yes, because nature has provided us with a fabulous orthodontic appliance in the tongue, hasn't it? I
Yes,
mean, the tongue and the cheeks and the lips are our built-in orthodontic appliance.
that's it.
If they are working for us, not against us. So let's talk a little bit about that, about how things can go wrong. I mean, like even from birth, what are some of the things that can cause imbalances where people aren't within their adaptive capacity?
I would say the big one is breathing.